So I'm Arindam Gupta. I head the healthcare and life sciences vertical in One Lattice. This is a tech-enabled next-gen market research, insights, and advisory services firm. And today we have Siddharth Angrish, who is co-founder and CEO of Jiyyo Innovations. So we all know that there is a very big urban to rural divide as far as healthcare is concerned in India. If you take the number of physicians per, let's say, uh, doctor to patient ratio, doctor to population ratio, it is highly skewed towards the urban area, right? Almost 35% of the population is in urban. And as per the latest estimate, maybe around 900 million people are in non-urban or rural areas, right? Which is supposed to be underserved. Of course, the government is taking a number of initiatives in the recent past. They have started with was the PMJ program, the health and wellness centers to really boost the primary healthcare, preventive healthcare in this underserved market. Also launched just during the COVID time the e-Sanjeevani platform of telemedicine. And if you see the recent numbers, almost 10 crore people have been consulted. Patients have been consulted by the e-Sanjeevani platform. But the question is, which we'll ask, of course, Siddharth, is the government only, agent in this change, or there is a role of private play here to solve this problem? And so I think Siddharth can give a brief introduction on what exactly Geo is all about, and then maybe come to this, question that what is the role of private play in this segment of creating high quality access to high quality affordable healthcare, good healthcare to the last mile. What do you say that?
Thank you, Arindam. Thank you for inviting me for the discussion. I'll briefly introduce, what we do at Geo, and then we can discuss about the topic you raised. Very interesting topic, by the way. So, I co-founded Geo, where we look at the last mile healthcare delivery, okay, in India, typically at the village and the town level. And so what Geo does is Geo is a chain of last mile healthcare delivery centers where multiple healthcare products and services are provided in the nooks and corners of India, which typically are villages and small towns. So, and the premise of what we are working on is that there is a remarkable unbalance in the distribution of qualified doctors, specialist doctors in rural and semi-urban India, which essentially has created a very natural and huge problem, an interesting problem. So where, we at Geo are looking at. Now, coming to the topic you raised, Arindam. So, see, government has rightly taken several measures in improving healthcare, in the country. The Ayushman Bharat Yojana, the Aadhaar card, and multiple related, aspects and services. They have acted very well as to show a direction, to the country in general and the private players in particular in healthcare sector. So and the role of a government is to regulate things, make things possible, bring them under the ambit of law, so that any private player, if they want to do something, they are covered by the law, right? That thing. So unnecessary problems do not arise. For example, Indian government, they brought out telemedicine practice guidelines in 2020 March, which was very helpful for many players, including us, to operate more confidently and with more velocity. So, but having said that, uh, typically in any industry, the real progress is made by the private enterprises, private players, because the incentive of success is directly attached, in that sense. So it's so typically, or in the ideal situation, is that the government and private sector, they work in tandem. They both help each other. They play their own roles, each creating more conducive situation for the other. And that, I think, is happening in India, right? A player like us, we are currently present in 210 districts of India, which are primarily non-urban. Okay, so, and this was made possible by, several, trends, and one of them was government supporting the telemedicine and other things. And of course, the other ones like mobile internet being available everywhere, COVID-19, which created extra awareness, social media's presence, so a bunch of those things as well. But at the end, I believe that it would be the private players who will take it, to the next level, who will improve it, add innovation, add more competitiveness. But at the same time, government, needs to ensure that the healthcare is not compromised. The poor people, the downtrodden, they continue to get, the healthcare cover from, various service providers. So it appears to be a very healthy mix as of now, as far as we are concerned, and we feel that the future is very bright in this direction. Uh, just from a problem-solving perspective, it is actually a massive problem, massive unsolved problem, where where again both government and the private sector can do wonderful work. And at the same time, we'll just add this thing that uh, providing better healthcare to the hinterland, okay, to the underprivileged areas, will also require a lot of innovative thought, in contrast to the conventional methodology of having lots of big hospitals, which exist in cities. They may not be possible or sustainable in the rural sector, which is sparse by nature.
One question comes to my mind. Of course, you are from a tech background, and we will understand. From of course, I know you left a very bright career. US, you are from a you did your engineering in computer science from IIT Roorkee. You went to John Hopkins to do MS in computer science. You had a very bright career in US, but you left and came back, right? So one question comes to my mind is like, people like you, who could have, really done well in US, continued with your, bright career prospects. What motivated you to come back and, get into this kind of problem solving, as you were talking about? So what motivated you, and what instigated you rather to get into this?
No, certainly, this is a very frequently asked question, and Arindam, the main motivation for me has been the absolute beauty of this problem which we are currently solving and continue to solve. And the problem is 600,000 plus villages, okay, spread across the entire country, where there is very sparse presence of qualified doctors, but they do have small time medical shops. Now, how can we utilize the existing thing, existing medical, whatever small infrastructure, to create a very large, healthcare system out of that? So, so again, this appeared to be such a beautiful problem, Arindam, that it appeared that getting to solve this thing could be, a wonderful thing to do. Okay, and why not? It's actually relevant as well at the same time. So would just characterize it as the problem solving maybe mindset. That was probably looking for some bigger problem to solve, and we found this thing, and we are happy we are solving it to whatever extent we can. Yeah. And also I'll draw another parallel to it. Now, how do we even kind of so in the computing world, okay, so since the computers were invented in mid 1940s, for next 50 years the major thrust of computing or computer developers was to create bigger and better computers, right? So from few hertz frequency to kilohertz to megahertz to gigahertz and then to supercomputers, it went on increasing. But towards the end of last century, in mid 90s, people started to realize that there is a limit to how powerful single computer you can create, and those were very costly as well. So, so again, the solution which came to to the fore was, instead of creating huge, powerful computers, but you cannot create lots of them because they are costly. Why don't we create, or work with thousands of smaller computers, right? And thus was kind of born the idea of distributed computing, which many frameworks like Hadoop and all incorporated in themselves, and was espoused and popularized by the likes of Google, Facebook, Netflix, and all these companies. And also this phrase big data became quite popular starting 2000, right? So so to some extent, we try to draw a parallel to the healthcare sector from this computing thing, that over last, let's say, 100 or 200 years, the development in healthcare has been on the similar lines, that create more powerful, well furnished, well equipped hospitals, right? And we succeeded, as a nation or as a civilization there as well. Delhi has around 10,000 healthcare facilities, right? But think about, they are so costly to come up with, and you cannot have them in Samastipur's villages, in Jaunpur's villages, or in Chhindwara's tehsils. You cannot have them there. So again, drawing from that distributed computing, we can have a distributed healthcare ecosystem where we leverage and upgrade the small medical shops and tie them into a super healthcare system. So maybe a small scientist in us that guided us ki, okay, try this thing, it makes sense, right? Why not? So and we are actually quite happy, curious, and motivated to push the envelope in this direction. And we continue to learn new interesting things, like how to extend it, how to make it sustainable, how to make it more transparent, accountable. So so this is deeply satisfying, and we see that lots of work, remains to be done in this direction, and we look forward to every day with a smile. Yeah.
It's actually really amazing and very wonderful to really, what you talked about is the analogy between the transformation in the computing world from building supercomputers to distributed computing, smaller computers and network them into a system. And you found an analogy here and how that transformation knowledge can be used in also a distributed healthcare system, whereas our healthcare is very much skewed towards building big infrastructure, big hospitals, and that can only has a limitation, right? It can only be built in the urban or semi-urban, not in the really those tehsils and all. So I think that's a great and amazing concept that you are on, and I wish you all the best. And the other thing I wanted to know is, of course, from a let's say the application of digital technologies. I think very important for this kind of model to succeed is to have a very sustainable healthcare delivery model, right? Where there is quality is ensured, there is measurement of quality parameters, metrics, so that you are able to, do this in a sustainable way, develop, and deliver affordable, good quality healthcare, on a sustainable basis. So there is a law, there has to be a role of digital play. So what is your view on that? What is how digital technologies can enable this kind of ventures, and you can be a role model for many others who can get into this, right? Because it's a vast market, 600,000 villages. Not it might not be possible for only one company to cater to all of them, right? So you can be a role model for other investors or other entrepreneurs who want to get into this. So so it'll be good to know from you, what is the role do you think of digital technology, how it can ensure quality delivery of sustainable quality in this ecosystem?
So, certainly digital technology is the center stage of what we do. We acquire our clients digitally, we service them digitally. Our 90% of our team remains in touch with our clients through digital mechanism, right? So, and actually, we are a product of the digital landscape which had arrived before we had begun the Geos thing. And this is also very helpful for the end consumer, the patient as well, because lots of things we do at our system, they are all trackable, they get recorded. So for example, every patient who consults on a Geo platform gets a e-prescription, which has all the necessary doctor's details, registration number, and all, right? The medicines, of course, everything is there, so that things are accounted for going forward, and things are also available for research, later in the future. And since the consultation also takes place through a video call, technically that is recorded, and we do record it in some cases, right? And technically all of them can be recorded for lots of video mining, going forward, developing more advanced technologies on how to handle patients, maybe training material for new students, right? And these kind of systems, they do not need additional work to build training material. Just record it and maybe some sort of analysis, and new students can get take a peek into how to handle critical cases. And uh, and also uh, the all the patients vitals, their follow up visits, their reports, everything gets logged. And we do follow this EHR standards of India, electronic health record standards. And uh, uh, and that also enables lots of transparency, accountability, as well as research and related aspects for us. And I'll also mention that uh, almost all geo clinics which exist right now, they approached us through social media. Okay, maybe 10% did otherwise that thing. So which is also a testament to the power of digital thing. Otherwise, going to again that tehsil in Chhindwara, is would be a very costly thing, right? And impractical to render such things. So and we acknowledge this thing and have been a recipient of these things, but we also are taking these to the next level. We continue to integrate new medical devices with our system to get better peek into the patient and digitally transmit the data to the doctor and get their feedback. We also work with several research companies, and try to propagate the data which is emanating from the ground. And uh, and lastly, this is just the tip of the iceberg. 600,000 plus villages, 900 million population, lot of work can be done in this direction. Yeah.
Again, I'll come to the government's initiative a bit, that they also very actively promoting the National Digital Health Mission, right? National Digital Health Mission and the ABHA cards, which is the ABHA accounts are being created. Almost like 25 crores as per the latest numbers, which is available from their website. Almost 25 crores ABHA IDs have been created. Maybe around 10 crore health, data has been, uploaded in those ABHA card. So it's a very, very going to be a very long journey, because it's very difficult and very, very cumbersome to cover whole population. But the role of electronic health record will be very important, right? Going forward, I think from the government side, and you also mentioned the government's role is more towards regulatory, creating the ecosystem. So, coming to this EHR part, what is I like to get your opinion on that, specifically on the EHR, because electronic health record. and you are catering to all these your clients digitally. So what is the role do you think of EHR here, and how it will develop as per you, and what are the initiatives maybe you have already taken to kind of get into that ecosystem and integrate with that ecosystem that the government is trying to create and of course regulate.
See, again, government has done a commendable job in showing the direction and willingness, right? For enthusiastic players like us now who feel convinced that there will be government support in this direction, right? These are may not be that uncharted waters. So and so which is great. But this other thing is that launching something, is one thing, but performing that activity with good quality, affordability, as you mentioned, the iron triangle thing, month over month, year over year, right? That is a separate thing. So, and that requires a collective support and adoption of good methodologies purported by government and other, agencies, and coming to a conclusion, and then being followed by other, agencies. For example, we are working towards compatibility with Ayushman Bharat. We understand, try to understand those things as much as possible, and try to align ourselves with them. I foresee maybe few months from now, or maybe in a year or so, we would be completely aligned with the government's work in these from a technical perspective, in these
Yeah.
direction. And EHR is, from a healthcare provider's perspective, sometimes can be seen as a very cumbersome thing, unnecessary thing. See, on ground, it's the economic incentive which drives, every action, right? So EHR on their own do not produce, revenue for the care providers. So not everyone might come jumping at it, right? Government can make it, enforce it, which some people might follow. That's a separate thing. But the community has to look into the reasons why some or many healthcare providers are not utilizing it, or working for it. So that has to be understood well and incentivized, in any proper manner. But once that is done, or even if 50% or 60%, whatever compliance we get, that will directly help the healthcare world, the research, and the humanity at the end. Because after all, we are humans, and knowing more about ourselves would benefit, us,
Right.
finally. So, but has to be incentivized in a understandable manner. To that extent, what we do at Geo is probably in alignment with the EHR expectations of the government, and we do try to document each and everything which is possible without creating unnecessary, work for the doctors or other stakeholders. And the other thing which we have learned is that, see, these things are typically a step by step process, right? So you launch, version 1 today, which creates some level of familiarity, and then maybe a few months later you launch number 2, and slowly in a 5-year, 8-year process, you can have a high level of digitization involved. So this is a strategy we follow with our health partners, our doctors. That okay, in piecemeal fashion, how can we achieve both ends, right? That thing.
Right. Okay, thanks, Siddharth. Thanks for your time